The global pandemic has really increased the need to look out for each other in terms of our mental health. A lot of funding goes into helping people who are already ill, but there's actually very little focus on strategies around how we can promote good levels of mental well-being and mental health before people get ill or sick.
And so we do not want people to wait until they get so distressed that they need to reach out for those professional services, because we also know that we don't have enough resources in the country. So what we're trying to do is to take a step back and to provide solutions for every person who's out there to improve their mental health and well-being before things actually become too bad.
The Be Well Lab is a group of people who've come together to innovate in the area of mental health and mental illness. In particular, we develop interventions and programs which help people to promote good levels of mental health. We have a research lab, that's the Be Well Lab, but we also have a company which is called Be Well Co. And Be Well Co does a lot of the service delivery because we have not enough clinical psychologists to look after the people who are ill. So leave alone the people who are struggling and are not ill yet. So we really need more workforce in that space. We know from our research there's a large proportion in our community who are actually struggling. They don't have mental illness symptoms, but they have very low levels of well-being.
We see that there are lots of people in that group. They refer to it as languishing, and they're at an 8 times more likely risk of developing a mental illness in the future. And then there aren't many services available to them, so that's the problem we're trying to fix. We need new solutions if we're actually going to solve this problem, and that's why we think that this preventative but evidence-based approach is really, really valuable.